Cognitive Behaviour Therapy. Change the way you think. Have you ever felt stuck in a negative thought pattern? Or found yourself constantly reacting to situations in ways you wish you didn't? What if I told you that by changing the way you think, you can change the way you feel and, ultimately, the way you live? Today, we're diving into Cognitive Behavioral Therapy, or CBT, a powerful tool that helps you do just that. Cognitive Behavioral Therapy, or CBT for short, is a type of talk therapy that focuses on the connection between thoughts, feelings, and behaviors. Imagine you're walking down the street and a friend passes by without saying hello. One person might think, they're ignoring me, and feel upset or even angry. Another person might think, they must not have seen me, and continue on without a second thought. Same event, to different thoughts, to very different emotional responses. That's exactly what CBT aims to address. It helps us recognize those automatic, often negative, thoughts and teaches us how to challenge and reframe them. The goal is to move away from irrational or harmful thinking and towards more balanced, helpful perspectives. CBT is structured and goal-oriented, which makes it different from some other forms of therapy. Sessions usually involve identifying specific problems and setting clear, achievable goals. A core technique in CBT is something called cognitive restructuring. This is the process of identifying negative thought patterns, also known as cognitive distortions, and replacing them with more realistic, constructive thoughts. One common exercise is the thought record. You write down a situation that triggered a strong emotional response, the thoughts you had in the moment, and the feelings that followed. Then, you challenge those thoughts by asking yourself questions like, is this thought based on facts or assumptions? And what's a more balanced way of looking at this situation? By doing this, you start to see the patterns in your thinking and realize that many of your negative reactions are based on distorted thoughts, not reality. It's important to note that CBT isn't about forcing yourself to be unrealistically positive. It's about being balanced. If something is genuinely tough or upsetting, it's okay to acknowledge that. The key is to not let distorted thinking make it worse than it needs to be. CBT is widely used to treat conditions like anxiety, depression, and even chronic stress, but its principles can be applied by anyone who wants to improve their mental health and well-being. You don't need to be in therapy to start practicing these techniques. So, the next time you get yourself spiraling into a negative thought, take a moment. Ask yourself, is this thought helpful? Is it true? And how can I reframe it? By changing the way you think, you change the way you feel, and that can lead to profound changes in your life. Change the way you think. Explore Cognitive Behavioral Therapy.